Right. Okay. To start, I've, like I said, been teaching for a long time. And what I have learned over the period is that if I tell you something, you will forget by the time the lesson is finished. That used to happen to me. If I show you something, you will probably remember, but if I make you do it, you will learn. So with our sessions, one of you is always in the hot seat trying to get a feel of the real exam. And we have courses here in Worthing, which are not face-to-face anymore. And then I have the unit with my colleagues in Calcutta, which I would certainly recommend you go to at least once before you take the clinical exam, because there is nothing that beats actually seeing a patient, feeling a patient, and talking with a patient. I can teach you as much as I want online. You can practice as much, but before you go to the course, practice what you see on your ward. Some of the information on our presentations and our sessions is confidential. The parents or the children have been very kind to give us their consent to use them for teaching. And I would expect you all to follow the GMC guidelines or your local country guidelines in India or in Malaysia or in Egypt or wherever you are, that you would follow patient confidentiality and will not talk about it or discuss it or make it widely available where it's not appropriate. Right. So in the video stations now, there are two stations you need to visit, A and B. And it's important to know what you would be facing. So that's a typical current mark sheet. You'd have your number there, you'd have the examiner's number there, date, time. But the more important thing is underneath. Identification of clinical signs, clinical reasoning, and management and planning. If you meet the standard, which has been set by the college and the examiners beforehand, you will get 2 for it. If you are borderline, you'll get 1. And if you fall below the standard, then you get a 0. Can we switch off the mics, please, everyone? Now, in this part, it's easy to score 6 for each station, and equally easy to score a 0 if you go wrong. 2, 1, and 0. And I think it is important for you to be very focused and very slick when you're watching the video. In both video stations, you will have an examiner present, and the idea of the video station is to assess your ability for clinical observation, ability to identify clinical signs, discuss the differential diagnosis, clinical reasoning behind the differential. So when you present your differential, don't just list it out A, B, C, D, E. Mention why you say it's A from what you have observed in the video clip, not what you have read in the book. Clinical reasoning for differential and then initial management. There is usually not enough time to discuss management in details, but timeline of the disease can be asked. You can be asked what happens to the child in 6 months, 1 year, 5 years, not what the management will be in 5 years, generally. So for each station, you have 3 minutes to watch the video and 6 minutes to discuss with the examiner. So while you wait outside, you would have a piece of paper giving you the relevant information about the video clip. In our setup here, we have that information once the video, in fact, actually starts. You'll be marked on clinical findings in domain C, identification of signs, present and correct interpretation. So that is very important. If you see a sign, you have to relate it again to the patient or the clip you have seen, not out of context, which a lot of candidates quite often would do. Differential diagnosis is domain D1, and appropriate steps you would want to do if the examination is not conclusive. And then in domain D2, investigations and management. Relevant investigations to the identified problem. Management plan has to be safe, ethical, and effective. Patient and parents' concerns need to be addressed, and appropriate escalation. Now, in appropriate escalation, as registrars, I would expect you to do most of the thinking and the groundwork. But if you are going to discuss the child with somebody outside the department, you will discuss it with your consultant first. If a child seems unwell and you're concerned, always mention in your management plan that you would discuss the child with your consultant for also. A prompt is provided to all candidates, and you need to stay in the room till the end of 9 minutes, even if you finish early. Can you please switch your mic off?
Doctor, please make one of us co-hosts. We will manage switching off the mic.
Yeah, but please, it's really impossible.
You can make one of us co-hosts by.
How do I make that? I'm not that IT guru. So let me go through it quickly, and then when we see the video, we'll do that. Okay, so the examples of the video. Say it again. Okay. Acute illnesses normally, seriously ill children, children with transient signs like bruising, which you cannot really bring to the clinical exam, neonates, again, who are generally not brought to the exam. There'd be short introduction, setting out the scene, grunting babies, murmurs, respiratory distress, rash, seizures, gaits. And the questions you will get is, what did you observe or note? Depending on the scenario, you may be offered a question in history, and you need to be very specific. You cannot go on about, like in a history station, what history would you like? And then one specific examination, what would you like to examine? Or what findings would you like to have to help you with your differential? Do not mention broad systemic examinations. I would like to examine the neurological system. No. I would like to examine the anterior fontanelle for bulging. Yes. And once you have given your differential, because we want only to have the viva on one condition, you will be prompted to say, right, if you mentioned it, it's good. If you haven't, then what if the child has X, Y, and Z condition? Hopefully you would have included it in your differential, but if you haven't, then you may not get a mark for this part of the station, but you would still score marks for the relevant investigations, treatment, and what else may be needed. If you finish early, you just have to sit quietly and no extra questions are asked. And that's a pyramid showing how you retain the information we discuss, and look at the bottom, teach others. So although you're practicing now, if you teach your juniors or your colleagues, that'll be the best way to retain the information you would be gathering over a period of months and then rest of your life. Because the idea of this studying is not only to pass an exam, which is important in the short run, but more importantly, to become excellent pediatricians who everybody would like to come and visit. Now, in the video format, I will have to request one or two of you to be the observers and one or two to have the examiner hat. That is, you have to be critical of the review, and then we will see who would want to be in the hot seat and be brave to bear it all. So that's the presentation. Let me stop here.